Good day everyone, my name is Kenneth D. Velasquez, Section 12A, Group 4, and a student nurse from Davao Doctors College. Today, I will be showing you my return demonstration in performing female catheterization. This is the introduction of a catheter through the urethral meatus into a patient's bladder. One of the purposes of this assessment is, of course, to assess the amounts of residual urine if the bladder empties incompletely. So, the materials that we need in this assessment are bath blankets, lights, sterile forceps, cotton ball with betadine, specimen container, catheter sets, and a catheter set includes a sterile gloves, absorbent pad and eye sheets, KY jelly as our lubricants, 10cc syringe with 10cc sterile water, of course Foley catheter, urine bag, and catheter tape. Completeness and organization of our equipment ensures our efficiency as nurses. And prior to performing the procedure, first we need to check the doctor's order for catheterization for us to ensure that you will be assessing the right procedure to be done with the right patients. So as I can see here in the physician's order, it says here, it was aforementioned that today I will be assessing Mrs. Justine Velasquez, and we will be having a Foley catheter and of course a specimen collection, and that will be it. Next is we need to perform hand washing before preparing the sets for us to deter the spread of microorganisms. Now, we will be identifying the patients and explain the procedure. Through this, the patient will feel reassured if the procedure is of course explained and if she is handled gently and considerately. Good day ma'am, my name is Kenneth D. Velasquez. You can call me Ken. I'm from Davao Doctors College, and by the way, I'm your student nurse for today. Before we start, may I see your wristband please? Can you please tell me your full name, ma'am?
Justine D. Velasquez.
How about your birth date, ma'am?
November 10th.
What would you like me to call you?
Sister.
Okay, so Justine, how's your day going so far?
Good.
That would be nice to hear, ma'am, and I really hope that our day will end up a good one. So for today's assessment, we will be having a catheterization and a specimen collection. So for you to be informed, ma'am, in this assessment, your private area will be exposed. Would that be okay?
Yes.
Do you have any other issues aside from that? Okay. So upon exposure, of course, we will be inserting a catheter into your private area for us to assess the amounts of residual urine, because you cannot empty your bladder completely in accordance with the physician's order. Okay? Do you have any other questions so far? Okay. So, of course, we need to provide privacy by screening or closing the room for us to respect the autonomy of our patients. Okay, so I will be locking the door, ma'am, okay? Now, position the patients in a dorsal recumbent position. And by the way, this is a back-lying position with the flex, with the knees flex and spread well apart. That will give comfort to our patients during the procedure. Also, this position will provide us a good visualization that is essential in inserting the catheter. Okay, ma'am, so can you please flex your knees for me? Can you spread it well apart, please? Are you comfortable with this position?
Yes.
Okay. So how about the temperature, ma'am? Are you okay?
Yes.
Okay. So, of course, we need to drape the patient, exposing only the area to be used, because embarrassment and chilliness will make the clients to become tense that can interfere with the introduction of the catheter. Okay, ma'am. So right now, I will be exposing your private area. Would that be okay? Are you ready?
Yes.
Okay. So I'm just going to insert the catheter and bring back to everything in normal, okay?
Okay.
Okay. Can you prepare that one, ma'am?
Yes.
So I will be placing this one in the medical hamper and I will be providing a new one, okay?
Okay.
Okay. Of course, drape the patient exposing only the part to be exposed. Okay. Make sure to cover this part here to provide comfort to our patients. Okay. So, of course, next we will be applying direct light for visualization of the genital area that will help us see clearly upon inserting the catheter. So this is my improvised light. So now we will be opening the tray and arranging the equipment for convenience and accordingly to avoid contamination of the sterile items. This is important because placing the equipment in order will increase the speed of performance and will also help us decrease the risk of any contamination when reaching over sterile items. Okay. Of course, using the sterile forceps, cleanse the area using cotton ball with betadine, which is an antiseptic and a disinfectant agent to prevent and treat possible infections in the vagina. Okay. So this is a cotton ball with betadine. Okay, ma'am, I'm starting ma'am now, okay?
Okay.
This is with betadine. Lastly. Okay. So now we will be opening the catheter set, observing sterile technique for us to maintain the sterility of the materials. So you can dispose this one out here. So in opening this sterile package, of course, start here and then here and then here. Okay, so for you to be informed that this area here is now all sterile, so be careful with this part. So you can actually. So now we will be putting on the sterile gloves, observing the proper technique for us to prevent contamination and to maintain the sterility of the sets. So as I have mentioned a while ago, this is sterile package composed of a sterile gloves. So just open this one and start the open gloving. So I'm now sterile. I will be putting this one into the receptacle. So now we will be putting on the absorbent pad and the eye sheets. So as I have mentioned a while ago, this sterile package composed of a eye sheet and a pad. So just reminding you that this is sterile. Arrange. Okay. Just stay still here, ma'am, okay?
Okay.
Stay still. Don't move, ma'am. Okay. So also for you to prepare, you need to insert the syringe into the catheter to ease the catheterization and the next procedures. So we will be opening now the catheter. This is the Foley catheter that I have been mentioning a while ago. So in opening this catheter, you can actually, this is just like a gloves. Open this one. And drape this one. Cord. Open again this one. And to prepare your syringe. So this is just an improvised 10 cc syringe with 10 ml sterile water. Okay. So next, we need to lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. This is important because lubrication reduces friction and prevents urethral trauma, thus reducing pain upon insertion. Okay, and of course, after lubricating, we can now put this one here. So next, we will be picking up the catheter at least 3 inches, just like I'm doing right now, from the tip of the thumb by using your dominant hand. After that, place the thumb and the finger with your non-dominant hand between the labia minora while separating and pulling it gently. This is important because separating the area surrounding the meatus provides visibility. Okay. I'm touching this one, ma'am, now, okay? Can you please move it here? So this time, you will be inserting the catheter into the meatus for 2 to 3 inches or until the urine begins to flow. So the female urethra is approximately 1.5 to 2.5 inches. So, of course, while inserting the catheter, we need to encourage the patients to breathe deeply and relax because relaxation of the external sphincter aids in the easy insertion of the catheter. Okay, now, ma'am, I will be inserting the catheter. I want you to deep breathe as I insert this one, okay? So I will be inserting it now, ma'am. Just deep, briefly, inhale. Exhale. Okay. So now, if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position because urine will flow out the catheter if the lumen is not occluded. So this So since my dominant hand is sterile, I will be getting the specimen container, which is also sterile. So pinch this one using your non-dominant hand and just put everything here. So that's it. Then get it back there for specimen collection. Okay, so after this one, you can actually rest your hand in the pubis area, just like what I'm doing right now, while holding the catheter in place to prevent pulling and pushing of the catheter. This is important because withdrawing the catheter and pushing it back in the urethra increases the possibility of urethral contamination. So after this one, connect the catheter to the urine bag and be sure that the bag is closed and kept the connection sterile so that the urine will not leak from the bag and maintaining its sterility. So, this is urine bag is also improvised and we are inserting it to the catheter, but always make sure to maintain the sterility. Okay, so now we will be inflating the balloon with 10 cc of sterile water using a 10 cc syringe. This will make us make sure that there will be no leakage of water from the balloon. Thus, it serves the purpose of anchoring into the bladder. Okay, so we have prepared this a while ago, so we will be inserting this one. So, just put it back there. Okay, then discard. So for you to make sure that it's inserted correctly, you can actually pull it out. Then if it tucks in, then your catheter is inserted correctly. So now since it's inserted, our hands can now be unsterile because the procedure is almost done. So now we will be securing the indwelling catheter by taping it to the patient's thigh and allow some slack of the tubing to accommodate the patient's movements. This will help us to secure the catheter properly, and slacking prevents tension of the catheter when the patient moves. Also, we need to attach the urine bag later. So since we are not sterile anymore, you can touch things that are not sterile. Okay, ma'am. So I want you to your thigh now unit here. Just this one. You can actually place this one. Just. Are you comfortable?
Yes.
Okay. Can I do the same? So we will be following the process of slacking here. So get your catheter tape and then do some slacking. This is just an improvised catheter tape. And just like that, it moves. Okay. So now, as I have said earlier, we'll be attaching the urine bag to a unmovable down parts of the bed below the level of the patient's waist. So if I say unmovable, do not place this urine bag into the rails which is movable so that you can prevent any incidents or damage to the area here. Okay. So the patient's face. Okay, ma'am, so I will be collecting the amounts of the residual urine later, okay? Okay, so now we will be cleaning our area here. So as I have said earlier, I'm just inserting the catheter and clean the area, okay? Trash can. Okay, so after this one, we will be placing the patient to a comfortable position to promote relaxation and comfort to our patients. So ma'am, just get it back here. Are you comfortable? So ma'am, this is a new top shape, as I have said earlier. Go. Okay, in the laundry hamper. So, lastly, do the aftercare, remove the gloves, do hand washing, and record the time of the procedure done, including the amount and color of the initial outputs. This is important because cleaning the environment promotes comfort to the clients, and documentation is important for future purposes. This here. So put this one in the trash can. And after, do some hand washing. Okay, Ma'am Justine, our assessment is done. Do you have any other questions so far?
Wala.
Okay, thank you for your cooperation for today. So that's it again for today. Again, I'm Kenneth Velasquez, Section 12A, Group 4, and a student nurse from Davao Doctors College. Thank you very much for watching. God bless.